South Sudan, Ethiopia, to give opinions and share our own experiences and so on. Now, it also happens that I think, if I recall, my memory serves me well, by around 2016, is when there was a conversation had started with CBM about and you heard how India had been one of our role models. In fact, the primary role model. Uganda had a program that was similar to the Kenyan context, but our interaction with it, although we learned from it, had taught us some things about what to do and what not to do in our work in Kenya. And we were now having this conversation, or rather, shall I say head office, Chris, you'll justify yourself, was having a conversation with CBM, and that matter now comes to the Kenya board, because now Kenya has a board. You know, Joyce doesn't just take orders from her supervisor, who happened to be Chris, upstairs. You know, there's a board here, and what happens in Kenya, the board has to approve. And sorry, Joyce, about those words, but she had to deal with those things, those kinds of pressures. And there's a conversation with CBM by the UK head office about whether to merge, or whether to stay separate. And I think that's what our team of the program had in mind when they were saying I have to share my personal stories. Because that was one of the hardest things to deal with. Because on one end, I'm aware the CBM has an ambassador or two in here. On one end, the CBM was larger, it was older, it was much more influential, and we shared similar values. So the board was really struggling on that. And we had a bit of comfort, you know, that CBM was doing quite a good of the resource mobilizing. So we wouldn't struggle so much about finding funds to pay staff and the rent. On the other side, we had a very particular focus on the Kenyan context and some needs that could not be dealt with in a wider context. They couldn't be dealt with in the wider context at which CBM was then working. So we had a number of meetings. I don't recall it being one. I think it was several meetings. And you know those kinds of meetings where if you are a chair who's somehow managed to keep your cool because there was cold water around, and you sort of like say, what we will do, this conversation needs to be continued because we are running out of time. So Joyce, please put it on the agenda as the first item in our next meeting. Is there any other business? And the subject ends there. So we had a good number of those kinds of meetings as we discussed that issue. Because nobody had heard about basic needs, and if we start as basic needs, where there will be all sorts of legal copyright issues and trademark legalities with the UK office and all that sort of thing. There are all sorts of legal issues. And we would then also have to persuade Basic Needs UK in Kenya to deregister, which we weren't sure we would be able to do. So there were those sorts of challenges for us now as the board, thinking both in terms of a local, very local context, and it's very relevant if you happen to be a sub-chief or a chief, or a county commissioner, or a district a county education officer, or somebody like that, who is thinking both in terms of the struggle, of the tension, of the national context, and your local context, the needs that are very specific to your context, that cannot be addressed in a generalized way. They have to be addressed in a very specific, tailored manner. So we struggled a lot with that, but finally we decided, or the board decided, the chair is not supposed to vote or influence the debate. But the board decided to form Basic Needs, Basic Rights Kenya. Now, when we came to discussing the transition legalities, that was another very difficult one, because like I said, there were legalities to do with the transition itself, and that was quite a tricky one also. And for a short period of time, we had Basic Needs, Basic Rights UK in Kenya, which was the program initially there with Basic Needs, Basic Rights in Kenya, and Basic Needs, Basic Rights Kenya. And poor Joyce would keep being asked, are you talking about Basic Needs, Basic Rights UK, or are you talking about Basic Needs, Basic Rights Kenya? And she would have to now manage in her mind, keeping very separate, accountable, auditable, traceable documents and reports for those two different entities. And the board itself needed to manage those two things. And yours truly here, being chair of both, now had to deal with that also. And a good number of people who were members in both of boards in both. So that was a tricky one. And like we said, I'm just sharing my personal story for those who struggle with those kinds of things, just to know, like Dr. Chitai said, all of us have mental wellness issues. So if you find yourself in those sorts of mental wellness issues, then you can know that it's not unusual. The transitioned, and Basic Needs, Basic Rights UK exited later by their own choice, by their own decisions, and Basic Needs, Basic Rights is what now we've had in Kenya here. So the last point that I would like to make here is the transition of let me ask Joyce to stand. Joyce to stand, please, and Rosemary to stand. Now, Joyce said, as you've heard a bit about how she was the founder. She doesn't like me calling her executive director of Basic Needs, Basic Rights. And she'd been running with it. And now, Joyce had said she needed to exit. We didn't retire her. She insisted that she needed to exit. We persuaded her to stay a bit. We didn't succeed too long. And we needed to find somebody to replace her. The conversation of bringing a new executive director who would replace Rosemary, who had all the institutional memory, which I have attempted to summarize. We are talking about something like, for me it was something like maybe 27, 25 years today. We had to now hand that transition that institutional memory so that it stays within the organization and it isn't lost by those who come later. And just to say thank you, Joyce, for the good work you did in supporting basic needs, basic rights, both two country director positions at the same time. So thank you so much. Now, the person who got herself in heavy shoes, yes, please, in heavy shoes is Rosemary. And Rosemary, maybe you just say a word. When the Rosemary came into office, what I tried and tried and tried, what do I tell Rosemary to prepare her at least psychologically for this position? And I don't know whether, Rosemary, you are able to just to say from where you are, just say one word or phrase that I told you that would help you to do that, which is the one that comes from my heart as a personal sharing with the team.
Thank you, Mr. Minor. Thank you very much, Joyce. I think you said many things. I remember you saying about the rarefied heights and stepping into really big shoes, but also to be grounded, to take on and do it as I would, not try to copy, because Joyce had, I mean, those were huge shoes. I would be lost in them, but just to do what I could best with whatever had been handed over to me, which Joyce did a very good job of. So thank you very much.
Thank you. So Rosemary, just to say thank you for the excellent job that you have done, and also to my colleagues who are with you on their behalf also, please accept the thank you to you. And then finally, this gentleman here, you have to come here, Alan. Yeah, one. Just now, when as a board, we were struggling with this transition of how to, now we are saying, okay, if we really want this organization to become sustainable, we have to institutionalize systems, we have to institutionalize structures, we have to institutionalize the culture of the way we work, and so on. On one hand, yours truly and others, and the other board members, we are struggling, but that we are not quite sure whether they are mature, the organization is mature enough for us to leave. A bit like the way you feel when your child has finished university and you're trying to make up your mind whether to tell them now they have to start paying rent in your house, because they have to learn that rents are paid. People are not given accommodation, and you'll not always be there to host them and feed them. So that's what the board was struggling with. That was one side. So is this organization able to stand without the institutional memory we have? The other side is, we know for this organization to become sustainable, it has to have these systems and structures and visual and culture of doing things and so on to be put in place. And we struggled through that process, and it was very difficult from a personal level, and the rest of the board members who are not able to be with us here. What I want to say is just to thank this man, Alan Oginga, because he's the one who came in after me and did a very good job from what the evidence I could see in the media and in the public space, because I didn't go visiting very often the office, unless there is an occasion like today, and to just say thank you, Alan, and the board, and the rest of the staff team also, and even more so to Alan, because I understand he's now handing over to another gentleman. So for me, I can just say, thank you, Lord. for this fine band.
What to say? To Engineer Maina and listening to Joe, you actually establish deep passion for mental health. Actually also having worked with Rosemary, and I can also say it now that I work with someone closely and is here. He can wave. He does not look like part of us, but he's part of us. This Geoffrey just wave. He's hiding like he's not part of us. So I can see the principles and where they're coming from. And as a person who is working in this organization, that helps a lot. Let's give Engineer Mai his flowers. So flowers, 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 kachua. Flowers, 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 kachua. Flowers, 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 kachua. All right, changing gears. That is founding board chair. Now we want to the current board chair on the other bit. However, the first time I met Alan, I thought he was the tallest guy that I've ever met in my life. But then I meet Chris. Then I'm trying to position them. I don't know whether at some point I'll get an opportunity to have them stand all together in front of us so I can be able to take a photo just to determine their height. So, Alan, please.
So thank you, Jay. This podium is here. I'm suspecting it's for government officials, but since it is here, and I'm here, I will use it to look as important as I can. So I'll make this very, very brief. I know there's some government officials who want to leave. Much of the journey which we wanted to talk about today has been spoken of by both Joyce and Engineer Peter Maina. So mine will not be long because it's just perhaps only 3 or 4 years out of the 20 years. So I'll be as brief as possible, recognizing that we have officials who would like to leave. So our chief guest, the Deputy County Commissioner for Bungoma County, Mr. Robert Kamau, our founding member, our founding patron, Chris Underhill, government officials here from national government, from the Ministry of Education, and also from the Ministry of Health, the Division of Mental Health, Dr. Mercy Karanja, our partners, donors, distinguished guests, members of the basic needs, the wonderful basic needs team, friends, colleagues, ladies and gentlemen, good morning. Or is it morning? Good afternoon. More good days? More good days together. So it's wonderful to be back in Bungoma. I was here a while back. Bungoma, I'm told, is the county of heritage and wealth. And Joyce has mentioned the eating habits and the dancing, so clearly the slogan is appropriate. I would like first just to say that anniversaries such as this one is an opportunity to celebrate as we are doing, but equally as what we've been doing here in the last few hours, a good time also to review where we have come from, which Joyce and Peter Maina have taken us through, and also where we are, which I'll talk about very, very briefly, and perhaps even where we are going, because as Peter Maina has mentioned, the baton has already been passed. And in the next few weeks, some members of the current board shall be leaving and allowing another team to take over. We have served our 6-year period, and as per our constitution, we then have to hand over. So Joyce has given some stories about how we work together. So actually I have two periods within this discussion. The 4-year period I spent and the formative team, and then the period I came in together with 5 other members to sit on the board. So Joyce has talked very much about the first period, but because it's about personal stories, I also just want to say one thing, just to emphasize what she mentioned about the stigma around mental health back then. It wasn't what it is right now. We've come a long way. And I remember coming from a different background as a young research and policy officer. Even my wife then, that was 21 years ago. And those who are married or youngly married, you know how you go through, they say the norming and the storming stages of marriage. She was not very comfortable with the idea of me transitioning to mental health. So when I came jumping up and down that I have a new job which I find very exciting and, behaving as if, she asked, so what are you going to be doing? So I said mental health, and I saw the body language and it wasn't very pleasing then. But luckily, over time, she realized that I'm actually being paid a salary. So I'm sure for you ladies, you know what that means in the home. So it kind of toned down the body language. So that's my personal story in the first period. So thank you, Joyce, for mentoring me, and not just myself, but for the team that you so ably put together in those formative years. And I owe gratitude to you in my own understanding of what mental health issues are and the development issues around mental health. So thank you once again, Joyce. So coming to the period, the last 5-year period where I've sat in the board, and the last 4 years as chairman of the board. Ladies and gentlemen, if you remember the year 2020 or around 2022 when we were coming to the board, this was during the pandemic, the global COVID pandemic. And in this country, you remember the phrase being said by our cabinet secretary, if we continue to behave normally, finish that off, COVID will treat us abnormally. And I still remember those phrases, and I asked myself, I'm coming to a board, how should I now behave, abnormally or normally? But this was because having community meetings, which is a critical component of the work that we do with the communities, those kind of activities were really curtailed during that period. And even as the board trying to get to know each other, there were not many opportunities where we could gather, face to face. So those were trying times and difficult times when we came into the board. Now I'd just like to mention that that group of people who came into the board, some are here. I see Rogers is here with us. Rogers, just wave. He's stood before, so don't stand again. We were also with Naomi, who joined the board at the same time as myself. And she's also a ministry official, so that helps with government. And then we had a young lawyer by the name of Luzati. She's been in Italy for a while, but has joined all the board meetings virtually. So we have young and old people in the board. And lastly, besides myself, we had the current vice chair, who is Dr. Jaguga, who is a psychiatrist at Moi Teaching and Referral Hospital. So the 5 of us came into the board and joined Peter Maina and Dr. Leki to form the 8 of us, and then they left, and then we filled the gap with the 3 who joined us, including Dr. Chitai. So if you remember back then, these were difficult times during COVID times, but as I always say, challenges sometimes come with opportunity, isn't it? So during the pandemic, and as the pandemic phased off, opportunity actually did strike us. And one way it did this was the landscape and the importance of community health programs in general took on unprecedented, recognition, both globally and also here in Kenya. So that was one. Secondly, mental health itself also began featuring more prominently, even here in Kenya. And luckily for us, we had been working at that point in time for 15 years in that space. So we were well positioned to be able to, to carry out the work of community health in Kenya. So as a consequence of these factors, and I must also mention the very good work of the Secretariat and the board members, I'm glad to say that from the year 2022 till now, our programs in this period have really expanded, and I may say exponentially. For those mathematicians, when you say exponentially, it means something. We have really grown in the last 5-year phase. And a perfect example of this growth is our Youth First Kenya program, a program that moved basic needs to a previously uncharted waters. And so for the first time, basic needs came face to face with the mainstream education sector through our mental health and resilient programs in schools. So the Youth First Kenya program, which is Ministry of Education accredited through KICD, now basic needs is actually one of our flagship programs within our entire programming. And we are happy to have representatives from the Ministry of Education here with us. And they are joined also by the Ministry of Health, who have been our mother ministry for many years. So welcome again, Dr. Karanja. So as I speak to you, through this YFK program, we have engaged in 3,400 primary schools together with our partners. Some TSC members are here who have been very, very helpful. We are almost 185,000 grade 7 learners in 13 counties in the Republic have covered this course, which is a critical component of what we now know as the CBE curriculum. So we are very proud of this particular program. So in summary, because of time, basic needs during this period has covered a number of extra counties. So in total, we are almost covering 18, 19 counties, I forget the actual number, from the few counties we had when the previous board was there. So we are also proud of that. With regards to our annual budget, which is primarily funded by our donors, and we are glad to have CBM team here, we have expanded our budget, our annual budget, not twice, not thrice, not 4 times, but almost 5 times in this current period. So that in itself we feel is something we can be very, very proud of. And led by the Secretariat and the very hard-working board members, we thank our donors for the support you've given us. Now, turning very briefly, as I conclude, to the issues around oversight by government, under the previous board led by Mr. Maina, and even for some time in the current board, we were regulated by the NGO Coordination Board. Now, during our period in the year 2024, the PBO Act 2013, which had been, sitting in the shelves for a while, was signed to law by His Excellency, the President William Samoei Ruto, and subsequently the NGO Act was repealed. So most NGOs are now registered as PBOs, Public Benefit Organizations, and are regulated by the Public Benefits Organization, we call it PBORA. So for basic needs, meant last year and also parts of this year, trying to review our own constitution to be in line with PBORA, and also to rethink our charter to conform to the PBO regulations. And on this, I would like to thank especially 2 members of our board, Dr. Chitai. Thank you very much for leading us in this process, and your engagements with PBORA did a great job. I'd also like to thank Wakili Al-Ati, who is, as I mentioned, in Italy, led us through the legal issues around the new constitution. So in many senses, our board has not sat and waited for quarterly meetings. We've been very, very engaged trying to support the Secretariat in some of these governance issues. So as I wind up, I think as I alluded to earlier, we are also in a transition year, as has been mentioned. And 5 board members will be leaving the board come next month after our AGM. We will have served the 6-year term, and so we will leave and exit the board in the next few weeks. So I'd just like to formally thank the 5 members who joined with myself. Dr. Jaguga is not with us, but I would like to thank her in absentia. Dr. Kinoti, once again, I'm mentioning you for the 3rd time. There you go. Dr. Rogers Kinoti has been our treasurer for this period of time and has done very great work. As I mentioned, growing 5 times in terms of budget needs a lot of governance around it. And thank you, Dr. Kinoti. He's also a lecturer, not just a CPA. So, tuko na watu hapo kwa board. Our Kiliati, we thank you in absentia in Italy. And also Naomi for the inroads that you've made through the Ministry of Health and helped us to work with government. Extraordinary work. Going forward, in terms of sustainability, we have new members coming in, so there's no vacuum left. And we leave you, new board members, in a very good position, ready for major takeoff, in my view. We are still with you. We are building and growing a basic needs family. So don't feel left behind or abandoned, so to speak. We have our founder member here who always talks about, always being a family, and we want you to recognize that we are still with you. Lastly, I'd like to thank the County of Bungoma through the Deputy County Commissioner for your warm welcome. The Country of Wealth and Prosperity. And dancing, there you go. Very beautiful county, and peace and rain. Very good. And also the county government officials who are present here. Thank you very much for your warm welcome. I think as Joyce mentioned, Bungoma County is where we've had the longest period of sustainable, continuous engagement in any of the counties that I've mentioned. So we do thank you for your hospitality. So I'd like to stop there, and once again just thank you everyone for coming to this celebration and a review of what we've been doing for the last 20 years. And as mentioned, we do have some other activities which will be guided by our team. So thank you very much, and aluta continue. Asanteni sana.
Flowers, flowers, flowers. Flowers, flowers, flowers. Flowers, flowers, flowers. Flowers, flowers, flowers. All right. Thank you, Alan. They said that Bungoma is a county of dancing, and true to their words, they are preparing you for a dance session in the community. The community has prepared you a dance session there. So I know speeches sometimes are not very interesting, but we have to listen to them, isn't it? But we still have a fun session that we need to catch up with. And without wasting time, this was your brainchild. You birthed it. People who grew it have spoken. Now it is also time to listen to you. Tell us. Are you proud of what you did? You are to answer when you are here in your speech. So I'd like to give Chris Underhill time to come forward, make his speech. And this is the special speech we've been waiting for, so that we can sum up this as we now take it to the government partners. Karibu, Chris.
Deputy County Commissioner, thank you so much for allowing me to speak today. I do appreciate that. And I would ask you to note that I have observed all protocols. Thank you very much. Yeah. Actually, I want to retain the voice with you one more minute, because I have decided to move here. Because the idea of dancing after supper is such a nice idea. The only problem that I have is that my wife is not sure. So if I can regulate that side of things, then my application will be in your office. Thank you, sir. It's a great honor to stand here with you today and to celebrate this anniversary, this 20th anniversary of this incredible organization. And I do appreciate being invited to speak with you today. It's not my intention to dwell on the past so much, but actually to spread the canvas a little wider and to talk about mental health and development, and the whole question of how we go forward, not simply as basic needs, basic rights Kenya, but as a movement of people concerned with global mental health. But when I founded Basic Needs in the year 2000, I could not have imagined that more than 2 decades later, I would be standing here in Kenya, and in fact in your own county, sir, watching an organization take the original idea that I had, make it its own, thank you, Engineer Minor, and carry it further than ever I could. And thank you very much, Alan, and Joyce and Rosemary for doing that. Basic Needs was born from encounters with people who had been left out of development altogether, people with mental illness and indeed epilepsy who were poor, isolated, untreated, and too often invisible. But it was also born from a stubborn conviction that these same people were not helpless, that with treatment, with livelihoods, with family and community support, and above all with dignity, they could recover their place in the world and shape their own futures. That is the vision. The conviction shaped what became the Basic Needs model. The idea was simple, actually, even if it were not yet popular. Mental health cannot be separated from development. That is to say, the development of the country, the development of the county, and the development of the individual. Treatment alone, though essential, is not mental health, is not, let me just quickly turn the page, is not enough. People need medicine, yes, but they also need work, family, they need community, they need rights, they need a voice. They need to be seen not only as patients, but also as citizens. Kenya became one of the places where this vision took root, and that is what we are celebrating today. And today we are not celebrating just an office. No. We are not celebrating a name on a sign or a project cycle. We are celebrating a movement of people, of relationships, and of patient, ordinary courage. We celebrate the staff and volunteers who travel difficult roads, who sit under trees, enter homes, listen to families, challenge myths, and build trust where there has been none. We celebrate the work of health workers and government partners, many of whom have dignified this meeting today, who insisted that mental health belonged in primary care and community care. We celebrate the families who traveled from fear to understanding, from shame to confidence, and from isolation to mutual support. And above all, we celebrate the people who lived experience, who found their voices, and who demanded not pity, but dignity, not charity, but opportunity, not silence, but rights. Over the past 26 years, since I started the organization, the global landscape has shifted. Mental health is more visible than it has ever been. It has found its way into global development agendas, into the conversations of governments, universities, international agencies, and civil society. There is more research, more advocacy, and a growing recognition of a truth that should never have needed proving, that there is no health without mental health. We have seen the rise of community-based care, of task sharing, of rights-based approaches, the voices of people who lived experience are more present, more organized, and harder to ignore. These are real achievements. We should name them. We should celebrate them, and indeed we do today. But anniversaries must also be truthful. And the truth is, the promise of global mental health has not yet been kept. The treatment gap remains vast. Too many people still receive no effective care. Medicines are still missing from clinics. Referral systems remain fragile. Families continue to carry responsibilities that should not be shifted by public systems. Funding globally remains painfully inadequate. Mental health is praised in speeches and forgotten in budgets. And awareness without services can become a cruel thing. It tells people to seek help while failing to make that help available. We must also remember that what medicine alone cannot do. A tablet may reduce symptoms, but it cannot by itself restore income, or friendship, or respect, or legal protection, or hope. For that we need development. We need community. We need rights. We need economic inclusion. And we need people with lived experience at the very center of decision making. Not at the edges, not as guests, but at the center. So what must we carry forward? I bring to you 4 ideas. We must keep insisting that mental health is a development issue. It belongs not only in hospitals and clinics, but in schools, in workshops, in homes, in county plans, in national budgets, and in human rights institutions. And second, we must keep services close to communities through primary healthcare workers, through community health promoters, peer supporters, family groups, and strong links to specialist care. Third, we must protect the leadership of people with lived experience. Nothing about us without us is not a slogan to be admired. It is a discipline to be practiced. It means sharing power, not merely inviting testimony. And fourth, we must stay practical. The basic needs model was always asked the following. The following simple human questions. Can this person get treatment? Can this family eat? Can this woman join a group? Can this man return to work? Can this child go to school? And finally, we must keep hope grounded in evidence. Hope is built when a person who has once isolated becomes a peer leader. Hope is built with a clinic, stocks essential medicines. Hope is built when a family stops hiding a loved one. Hope is built when a person with lived experience earns an income, speaks in public, studies, leads, and belongs. Looking back, I am filled with gratitude. Gratitude to those who believed in basic needs when the idea was young and the future uncertain. And we have spoken about that. To colleagues across Asia and also Africa and of course Kenya, who shaped this model through practice, not theory. To donors, partners, and researchers who took risks, to community workers who did the hard, quiet work far from conference halls. And deepest gratitude to the families and to the people with lived experience who taught us what dignity really means. I feel particular gratitude today in Basic Needs, Basic Rights Kenya. You have carried this work forward, and congratulations for that. You have made it Kenyan. You have adopted it, challenged it, strengthened it, given it new life, and taken it into your heart. And that means so much to me as the original founder. And indeed, no founder owns a movement. At best, a founder helps to light a fire. It is others who keep it burning, who carry it to new places, and who ensure that it warms those who need it most. That is what you have done, and that is why we are here today. Let us celebrate these 20 years, the lives changed, and human dignity, development, and justice. When Basic Needs began in 2000, we were trying to say something quite simple, that people with mental illness, and in those days people with epilepsy as well, in poor communities have the same right as anyone else to treatment, to livelihoods, to family, to community, to respect, and to hope. 26 years later, that message remains as urgent as ever, and may the next 20 years of basic needs and basic rights, Kenya be bold, locally led, rights-based, community-rooted, and unafraid. May this organization continue to remind the world that mental health is not only about illness, it is about belonging. And may all of us leave here today with renewed determination to build communities where every person is seen, is heard, is supported, and free to live with dignity. Thank you, sir.
So we're going to give Chris 5 flowers. That means 5 kashuas. All right? And Chris, as you said, I am one person who wouldn't be here if you didn't create this. This is the platform that gave me an opportunity to bounce back. So I am living it. So when you speak, it connects to me. All right? And I use this as a voice to talk to other people who might not be courage enough to come out here and speak about them so easily as we do. So let's give Chris this. Flowers, 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 flowers. Flowers, flowers, flowers. 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 Flowers, flowers. Alan was counting. All right. I would like to remind you, I would like to still remind you that we have, this is not the main event. The main event is in Chesikaki. And our custom here, as customary here, we will dance. All right? So if you have 2 left legs like myself, don't worry. It is all going to be inclusive as well. All right. So I would like to change gears. And Alan mentioned about Youth First Kenya and how it has taken us to many counties. I'm one of those officers in Youth First Kenya in various counties, our regions of coverage. And that work wouldn't have been possible without our friends and partners in the Ministry of Education. And I would like to take this mic to them right now so that they can also share with us how the journey has been. All right? And I know this also speaks to the bigger picture. We were also, courtesy of the work we do with them, we were also invited by the Division of Mental Health, School Mental Health, to hugely contribute our experiences in terms of how can our work contribute into making better the guidelines for implementing school mental health, especially targeting adolescents. And this time, allow me to, on behalf of Director Policy Africa, Dr. invite Phyllis to take us up through this session that will involve also recognizing her colleagues and also people from the TSC.
Thank you, Jay and the team. I would like to observe the protocols in the house, and before I speak, what the Minister of Education, thank you. Before I share what the Minister of Education has about this program, to organize many of the representatives from the sector. Minister of Education operates within a very broad spectrum of stakeholders, including the Teacher Service Commission, semi-autonomous government agencies, and is so together. Before I make the Minister of Education statement, I request kindly TSC, who is in the house, to make. We are implementing teachers who are who are under the custody of the Teacher Service Commission. I also understand that the CSO is in the house and you will also recognize the presence of the curriculum support officer. Thank you.
Good afternoon. I'm reading on all protocols well observed. I take this opportunity to appreciate the good work of basic needs, basic rights, and at this juncture, because of time, kindly my colleague from the Teacher Service Commission, our CSOs, if you are here, kindly stand up before I make the remarks.
The board. Thank you.
Team. I'm not under TSA. I'm a quality assurance and standards officer in Ministry of Education, National Government. Thank you very much.
Thank you. So, my name is Perpetua Werimu Ngugi. I work at the Teacher Service Commission. I am a staffing officer. Basically, we're in charge of employing teachers, and as you have seen in this program, teachers play a very integral part in implementing all these policies for basic needs and basic rights, and therefore allow me to read something small, because I've been sent here to represent my seniors. And yes, so distinguished guests, colleagues from the Ministry of Education, founder and former board members of basic needs, basic rights, partners, teachers, ladies and gentlemen, I'm honored to join you this morning on behalf of the Teacher Service Commission as we reflect on the inspiring journey and milestones of the Basic Needs, Basic Rights program. Today's engagement is particularly meaningful because it highlights the role teachers continue to play beyond classroom instruction as mentors, counselors, protectors, and trusted guides in the lives of learners. The Teacher Service Commission appreciates the contribution of teachers who have participated in the implementation of this program over the years. Their commitment demonstrates the important role teachers occupy in supporting not only academic achievement, but also the emotional, social, and psychological well-being of learners. As a commission, we recognize that effective teaching and learning can only thrive in environments where learners feel safe, supported, heard, and valued. Increasingly, schools are confronting complex challenges affecting learners, including anxiety, stress, social pressures, violence, and other psychosocial concerns that directly impact participation and performance. And to this end, teachers have been trained, especially through this program, on resilience and life skills, and thus, as the Teacher Service Commission, really appreciate the role that Basic Needs, Basic Rights has played to bridge that gap. And this is very important because effective education outcomes are achieved through empowering of those teachers. And this means that enhancing the capacity of teachers, not only as curriculum implementers, but also as frontline support persons who interact daily with learners and are often the first to notice emotional distress, behavioral changes, and emerging vulnerabilities. So as much as our work is to employ and remunerate the teachers, we are also not ignorant of the fact that they play a very crucial role in helping the learner to be an all-rounded person, and especially taking care of their mental well-being. The Commission therefore values programs such as basic needs, basic rights that equip teachers with practical skills for mentorship, psychosocial support, referral pathways, and learner engagement. We particularly appreciate that the program has utilized teachers as key agents within schools and communities. This has strengthened ownership, sustainability, and trust within implementation processes. As we listen to the experiences and milestones shared today, we acknowledge the dedication of teachers who have willingly invested their time, energy, and compassion in supporting learners beyond their formal responsibilities. Allow me to commend the founder, former and current board members, partners, and all teachers who have contributed to the growth and impact of this initiative over the years, and basically those 20 years, we cannot take them for granted. The Teachers Service Commission remains committed to supporting teacher professionalism, learner well-being, safe learning environments, and partnerships that strengthen holistic education outcomes. Thank you, and I wish you fruitful reflections and discussions as we soldier on. May God bless you.
Thank you very much. And over to the Minister of Education. Thank you, my colleague, is the Quality Assurance and Standards Department. Quality assurance comes in very handy in ensuring that the interventions remain relevant. And thank you, my colleague, for being here. Allow me to, therefore, read my presentation as handed to me by the Director, Policy, Partnerships, and the East Africa Community Affairs, of course, on behalf of the Principal Secretary in the Ministry of Education. So, distinguished guests, the founder of the Basic Needs, Basic Rights program, Mr. Chris, former board members of Basic Needs, Basic Rights, representatives from the Ministry of Health, Mental Health Department, Teachers Service Commission, program implementers, ladies and gentlemen, on behalf of the Ministry of Education, we are honored to join in as we celebrate the 20 years of impact of the Basic Needs, Basic Rights program implemented through the Youth First Kenya program. I acknowledge that we have relevant institutions represented here, including government, county government, the teacher development partners, teachers, maybe, implementers, and say that this partnership is what has made this journey possible. The government of Kenya remains committed to the provision of quality, inclusive,